over 60. These 7 tricks could save your life during a heart attack. The leading cause of death for people over 60 is heart attacks. Most people over 60 have at least one risk factor for a heart attack, such as high blood pressure or diabetes. And there's a lot of misconceptions about what causes a heart attack. Many people believe that stress, cold weather, or physical exertion can trigger a heart attack. However, none of these things have been proven to cause a heart attack. There are 2 main things that cause most heart attacks: coronary artery disease and arrhythmias. Coronary artery disease is when the arteries that supply blood to the heart become narrow or blocked, which can cause chest pain or shortness of breath. Arrhythmias are problems with the heart's electrical system that can cause the heart to beat too fast, too slow, or erratically. This can also lead to chest pain or shortness of breath. Some tricks can help you survive a heart attack until help arrives. It's important to remember that not everyone will experience all of these signs. Some people may only experience 1 or 2, while others may experience many more. If you suspect you or someone you know is having a heart attack, don't wait to see if symptoms improve. Seek medical attention right away. The sooner you get treatment, the better your chances are of surviving a heart attack and recovering quickly. So without further ado, let's dive into our list of 7 tricks that can save your life during a heart attack. Number 1, don't panic. Staying calm is crucial in surviving a heart attack. When you panic, your body releases adrenaline and cortisol, which can increase your heart rate and make it harder for your heart to pump blood. To stay calm during a heart attack, try to take deep breaths and count to 10. If possible, lie down in a quiet, well-ventilated area and relax. It's essential to stay conscious and not lose consciousness during a heart attack, so that you can follow the other tips on this list. If you can stay calm and focused, you'll be able to take the necessary steps to save your life. 2. Chew aspirin. Chewing aspirin can help reduce the symptoms of a heart attack by preventing blood clots from forming. Blood clots are one of the leading causes of death during a heart attack, so it's important to take action as soon as possible. Studies have shown that chewing 2 aspirin tablets, each containing 325 milligrams of aspirin, can reduce the risk of dying from a heart attack by 21%. However, it's important to note that not everyone should take aspirin. People with asthma or other respiratory problems, stomach ulcers, or bleeding disorders should avoid aspirin. Additionally, children and teenagers should never take aspirin. If you're unsure whether or not you can take aspirin, it's always best to err on the side of caution and consult with a healthcare professional. 3. Call emergency services. Calling emergency services is crucial in surviving a heart attack. When you call 911, trained dispatchers will guide you through the necessary steps to help keep you alive until emergency medical services arrive. They can also contact the fire department and any other relevant agencies to ensure that you receive the appropriate care as quickly as possible. It's important to call for help even if you're not sure if you're having a heart attack. It's better to be safe than sorry, and the sooner you get medical attention, the better your chances of survival. 4. Don't drive yourself to the hospital. After calling emergency services, it's important to stay put and wait for them to arrive. Driving yourself to the hospital is dangerous and could worsen your condition. In some cases, it might even be impossible due to the severity of your symptoms. For example, if you're experiencing chest pain and difficulty breathing, it would be unwise and potentially life-threatening to drive. Additionally, if you lose consciousness, it would be impossible to drive yourself to the hospital. Therefore, it's crucial to stay put and wait for emergency medical services to arrive. They re-equip to handle your situation safely and efficiently, and will prioritize getting you the urgent medical attention you need. 5. Loosen tight clothing. Wearing tight clothing can restrict blood flow and make it harder for your heart to pump blood effectively. This can exacerbate the symptoms of a heart attack and make it more difficult to breathe. To prevent this, you should loosen any tight clothing, including belts, ties, and jewelry, as soon as possible. Doing so will allow for better blood circulation and make it easier for your heart to function. Additionally, it can help reduce feelings of panic or anxiety, which can worsen the overall situation. By taking a few seconds to loosen your clothing, you can potentially save your life during a heart attack. 6. Don't eat or drink anything. Eating or drinking anything during a heart attack can complicate medical treatment and potentially worsen your condition. Medical professionals need to be able to monitor your symptoms and determine the best course of action, without the added variables that food or drink can introduce. For example, if you eat something before receiving medical attention, it can make it more difficult for doctors to diagnose you or administer certain medications. Additionally, eating or drinking during a heart attack can delay treatment by valuable minutes, as medical personnel work to stabilize your condition. Therefore, it's important to refrain from consuming anything until emergency medical services arrive and provide assistance. No. 7. Keep nitroglycerin handy. Nitroglycerin is a medication that can help alleviate the symptoms of a heart attack by increasing the amount of oxygen-rich blood that reaches the heart muscle. It's commonly prescribed to individuals at risk of heart attacks and can be purchased over the counter in some countries under the brand name Nitrostat. To use nitroglycerin effectively during a heart attack, place one tablet under your tongue and allow it to dissolve. If your symptoms persist, you can take a second tablet after 5 minutes. However, it's important to note that nitroglycerin can have side effects such as headaches, dizziness, and low blood pressure. If you experience any adverse reactions, discontinue use and seek medical attention immediately. Furthermore, you should never take more than 3 nitroglycerin tablets in a 15-minute period. Doing so can be dangerous and potentially fatal. In conclusion, surviving a heart attack requires quick thinking and swift action. Following these 7 tricks could save your life during a heart attack. Remember to stay calm, chew aspirin, call emergency services, loosen tight clothing, don't eat or drink anything, and keep nitroglycerin handy. It's important to stay informed and prepared in case a heart attack occurs. By following these steps, you can increase your chances of survival and make the waiting time for emergency medical services less stressful. If you enjoyed this video and found it helpful, please give it a thumbs up and share it with your friends and family. Subscribe to our channel for more health and wellness tips. Stay healthy and take care.